Here at ASH 2015, I'm Thomas Baldrick, joined now by Dr. Jan Beyer-Westendorf from Dresden. Thank you, sir. I know it's been a busy conference. Thanks for coming by. So you got a couple posters. Let's talk about one of them, and Noacs in pregnancy.
Yes.
So let's get into some of the issues. If a young female patient gets anticoagulated, is pregnancy a problem for her?
Yes, it is. For two reasons. First reason is the reason why the patient is being anticoagulated. Most of the young female patients getting anticoagulated because they have either a heart condition or they have a venous thromboembolism. Both of them put them at a high risk of pregnancy complications. The second reason why pregnancy in anticoagulated women is a problem is the fact that some anticoagulants actually may cause harm to the fetus. So this is something that has to be considered, both the health of the mother, but also the well-being of the fetus.
What types of anticoagulation can be used in women who are pregnant?
The standard nowadays is clearly low-mercury heparins, which can be used over the whole period of pregnancy with an acceptable side effect profile and a high effectiveness to prevent coagulation problems like thromboembolism. Some patients with mechanical heart valves need to be treated with vitamin K antagonists, but that's only a minority. So the vast majority of pregnant patients in need of anticoagulant therapy get treated with low-mercury heparin.
What is the significant issue for why Noacs cannot be used or should not be used in pregnancy?
Again, there are two reasons for that. The first reason is they are very small molecules which are known to cross the placenta, so they actually anticoagulate the fetus as well. And the second issue is that we actually don't know whether this is can cause a potential harm to the fetus by causing either bleeding or anatomical abnormalities. So we don't know that yet.
What do you know about a protocol in case a woman who is pregnant gets accidental exposure?
This is exactly what my poster was about. So I had experience that some obstetricians and gynecologists recommend elective abortion for female patients who got accidentally pregnant or unplanned pregnant while taking a Noac. So that got me thinking whether it's really it's a valid approach to recommend elective abortion to those patients. So I wondered what data are there that give us an indication whether there is a medical issue. So we collected from a number of sources. We collected more than 200 or more than 300 reports actually of patients being exposed to a Noac in pregnancy. And when we got rid of duplicates, obviously some patients will be in more than one database. When we got rid of the duplicates, we ended up with 230 patients that we had well documented the type of Noac they received, the duration of Noac exposure in pregnancy, and so on. And out of those, we had outcome data on 137 cases. And when you look at the outcome of those patients, we had more than 60 live births, which is quite a good proportion of patients. And out of those, we had three babies where there was a suspicion of an anatomical abnormality. I'm not saying that the Noac exposure actually caused it, but out of those 60, something I think 64 if I remember correctly, 3 had some suspicion of having abnormalities. We had another 31 miscarriages, which sounds like a large number in 137 cases, but actually if you consider the fact that those patients are patients with a coagulation abnormality, that's why they are being anticoagulated in the first place. So a miscarriage rate of 20% is nothing of a surprise. So this is pretty much what you would expect in the population. So there's no indication that Noac cause harm there. And we had 39 elective abortions, which tells you that there's quite a number of patients out there where the attending obstetrician or gynecologist really recommend elective abortion because of the Noac exposure. And I think that is not justified. And this is the main outcome of our poster, that the absolute numbers are low, so we cannot definitely say Noac exposure in pregnancy is not an issue. but it doesn't seem to have a high risk of embryopathy, which is the first good news. And the second good news is, so far I think it is not should not be recommended to counsel the patient in favor of elective abortion just because of the Noac exposure. If there are medical reasons, if there are social reasons, that's a different story. But just because the patient became exposed to Noac in the early pregnancy, that is, according to our data, does not justify an elective abortion.
Sensitive issue, obviously further research could be done, will you?
And it has to be done, definitely. So I think the ASH is a great place to announce this project. And actually in the process session yesterday, many people came to me and asked about the project, asked about the poster, and they offered me to send me further cases from outside of Germany, which obviously I don't have hands-on contact to those. So I'm very much relying on this kind of setting to get more cases sent to me. And on my poster I promoted an ISTH registry, which is just about to get started. It's going to be a worldwide prospective registry, a case collection basically of those Noac exposures in pregnancy. And we are trying to collect long-term data until the 5th year of the kid. Just to see whether there are late developmental problems associated with exposure.
Well, hopefully this interview will help get you some more cases.
I hope so very much.
Thanks for your time,
my
sir.
My email address is jan.beyer@uniklinikum-dresden.de. So please send me your cases.
We will,
Thank
sir.
you.
Thank you.
Thank you. Good.